CDC reports there are at least 570 cases of MIS-C across the country, and now one of them is in Idaho. Dr. Kenny Bramwell talked to reporters about the case of a 7-year-old girl who lives in the Treasure Valley. She came in last week to the pediatric ICU.
Because of the prevalence of this disease has gotten so high locally, and since this happens in about 1 out of every 1,000 patients with COVID, we really expected that it was really a matter of time until we had a patient like this here in our PICU.
She has since been discharged, but Dr. Bramwell wants parents to be aware of this disease.
Unfortunately, I do expect that we'll have a handful more of these cases as the prevalence continues here locally.
The doctor says patients with MIS-C can get very sick. According to the CDC, patients can experience inflammation in multiple areas, including the heart, lungs, kidneys, brain, and gastrointestinal organs. The average age for patients is 8 years old. Symptoms are varied, but can include things like fever, vomiting, neck pain, rash, and bloodshot eyes. Doctors say patients often start showing MIS-C symptoms 4 weeks after exposure to the coronavirus.
I think this is an important thing for families to be aware of and for physicians to be aware of as they care for patients, but I'm trying not to be alarmist about this.
At this time, it's not clear if there are more risk factors that make someone more likely to get MIS-C. In this first case from Idaho, the patient didn't have any pre-existing conditions. It's also not clear how contagious the disease is.
Wearing a mask, watching your distance, and washing your hands, I think our best way to prevent MIS-C and to prevent spikes in other pediatric illnesses related to COVID is for all of us to just watch those 3 things and make sure we're being vigilant for the protection of ourselves as well as our children.
In Boise, Joey Prechtel, Idaho's News, Channel 7.